Let's talk about the crown and how difficult it can be to transplant and why non-surgical hair restoration should be one of your first choices when dealing with the crown. Now, in one of my videos, I talked about how to get a good result. And one of the key principles in there was thinking about the supply demand, the supply of hairs you have and the demand you could have over time that you may need to restore. A lot of people don't have enough hairs to transfer to cover their entire head. So you have to be strategic about where you want to place these hairs. So if you're someone who has thinning in the crown and thinning in the front, you need to decide whether you have enough hairs to address both. And in most cases, it's a better idea to transplant the hairline and to treat the crown non-surgically or to stage it as one of your second or third procedures. Why is that? That's because the crown is a circle. And every centimeter it expands, it doubles in its area. That means its demand grows exponentially compared to its size. And the crown, all the hairs point away from the center, right? That means that as that circle grows, that halo is visible. If you plant hairs in a high density right in the middle of that crown and it expands, you'll end up with a donut and it'll become very unnatural very quick, and you may not have enough hairs to chase it all the way to the very end. So what do? Well, number one, you try non-surgical therapies for your crown first. If you have hairs there that are half their thickness or more, it's definitely worth trying ACS in your home therapies well before doing a transplant. Second, when you're transplanting the crown, be conservative. Don't lay down a huge density of hairs in a very small area, because you're going to have to follow along with that very dense amount of hairs for the entire crown in the future. And if you just lay down a small amount of hairs and use something like a topic fiber, you'll have a much easier time meeting the needs over time. Now, this doesn't apply to everybody. If you come to the office and you're 55 years old and you have a nice solid hairline, all you have is a small crown, you've proven that your crown is progressing very slowly, and then you're going to be able to meet the demand issues over time. And at that point, doing the crown surgically should be just fine. And that's usually where I had to help my patients make decisions about whether or not to do the crown and how to do it, whether to address it non-surgically or surgically. Now, in our office, we do have a policy. We don't want people to invest in non-surgical, then be unhappy with the results, and then have to transfer to surgical and all of a sudden spend double on the hair restoration they plan to. We take the physician's fee, my fee, and if non-surgical fails, we will transfer it to a transplant if it's the right thing for you, but we'll advise you on how to appropriately to restore that crown with a lesser density than you're probably hoping for. And unfortunately, this is the truth about the crown. It's just a little bit less forgiving with long-term planning. Its acceptance rates are a little bit lower, meaning its graft survival rates are a little bit lower. And the results, they're not directly on the face. They're not framing out the face. They're really just, people are just looking at the density more so than the shape it creates and all these other things. So it's a little bit more difficult than the front hairline, which I absolutely love and which we're known for.